Hello, I hope wherever you are today, it's as a beautiful day as it is here for us. I'm Denise Fleck, the Pet Safety Crusader, coming to you with my twice weekly vlog, hoping to help you be the one who makes a difference in the life of an animal. And today is part 2 of what we started earlier in the week, symptoms that you must not ignore with your dog or cat. And in the previous episode, we covered things like seizures and bloat and bleeding and fever. If there was blood in any form of excretion, urine, feces, vomit, diarrhea, if your pet was having trouble urinating or defecating. So all of those were must go to the vet right away symptoms if you notice them with your pet. They can be symptoms of a multitude of injuries or illnesses, but they are things that definitely require veterinary attention. So today we're going to add to that list that we talked about earlier in the week and go over some other things you may notice in your dog or cat that really makes that red flag go up and makes you get in the car with your precious furry one and have a professional medical attention given to them. You know, in some cases it may just be something minor, but other times it is going to be very serious and you're going to be so relieved that you didn't delay getting your pet the help they needed. The first one I want to talk about are bite wounds. And most of the time this, comes from another animal. I suppose a human can bite a dog or a cat too, but we're generally talking about, a dog biting a dog or a cat biting a dog or vice versa, or it can even be a wild animal, a raccoon or a coyote or a mountain lion. Obviously, all kinds of tissue damage can occur depending on the strength of the animal doing the biting and, whatnot. But very often when it's just two, pets that get into a tangle, very often if we don't see blood right away, we think, oh, no big deal, nothing happened. I want to strongly encourage you, anytime there's an animal fight, that you get your pet to his corner and really give him the once-over, feeling him from head to tail and really watching the face. Even if you don't feel something, when you hit a sore spot, you may notice a grimace or a growl or a hiss in the pet's face. And it's so important that you find the bite wound quickly and get it cleaned out. And like I said, in most cases, really go to the vet for a quick checkup. It happens with dogs too, but cats in particular, when they bite, those needle-like teeth penetrate, and there's just something in their saliva that doesn't agree with us and often with dogs as well. And, in the case when a bite wound actually bleeds, it's a good thing. I know we don't want to see blood, but as things are bleeding, they're actually cleaning themselves out. The bite wounds that don't bleed are the ones that are most problematic because, number one, we often don't discover them or we don't think they're a big deal. You never want to pour hydrogen peroxide into a deep wound. Just keep that in mind. But if you do find a bite wound, clean it at the very least with water, but go to your pet first aid kit and get out that chlorhexidine. You may have it under the local drugstore brand called Hibiclens, but I'm talking antibacterial soap. And then you're going to watch that. If it seems deep or particularly sore, don't delay. What happens with bite wounds when we don't discover them or don't clean them properly is in 2 to 3 days, your pet has an abscess. And that's an infection growing under the skin where drains actually have to be put in, or sometimes they have to be lanced open. And, lots of antibiotics and all kinds of care, and they take a while to heal. So if you suspect a bite wound, look your pet over really well. At the very least, clean it with antibacterial soap and get a veterinary check for possible antibiotics. Pale gums are something you absolutely must never ignore. The gums were around the teeth. It should always be that bubblegum pink. Haiku's chiming in today. But there are some pets that just don't have pink gums simply because they have darker pigment in their skin. So be familiar with your pet's mouth. Get him comfortable with letting you look at him. And for those of you that haven't taken a pet first aid class, what you need to know is that the gums are the place that we check capillary refill time, CRT. Capillaries are the smallest vessels in the body that carry blood and oxygen throughout. And if we were going to check capillary refill time on us humans, which simply means we're kind of doing a layperson's way of checking circulation, Where we would check it is we would press on our fingernail bed here till we turned it white. Then when we release the pressure, we say how quickly the color pink comes back. For a moment in time here, what we're doing is we're stopping the blood and oxygen flow through the capillaries at our extremity. And when we release that pressure, if we have a good, healthy circulatory system, things start flowing again very quickly. That's why they turn pink. Well, in our pets, the best place to check this is at the gum, the mucous membranes, or even by pulling down the eyelid to see if there's a good pink color. So we want to see that good pink color, or if we're actually applying the pressure, lifting the lip, pressing on the gum, we want that color to come back in 2 seconds or less. If it takes any longer than 2 seconds, if the gums are already pale, if the gums look blue or gray or even yellow, which I'm going to certainly talk about today, get your pet to medical attention. This could be a life-threatening ailment. Lethargy and weakness. Anytime your pet's unusually tired and you haven't taken them, for a 5K, anytime there's any weakness in the legs that they're having trouble standing up, it's important, just to have a physical done. Since we can't, ask our dogs and cats, where does it hurt, or do you have a boo-boo, or how are you feeling today? I mean, we can certainly ask, but we're not going to get an answer that most of us are smart enough to understand in dog or cat language. It's important that, we are the advocate, that we speak up for our pets who can't speak for themselves, and that we get them checked out. And sure, it could just be some tiredness. So I'm, not saying if your pet's just particularly tired today, but if there's a real feeling of malaise, this has been going on for days, or there's weakness or the inability to use any limb, always get a veterinary checkup. Very often veterinarians can tell just, outwardly and by feeling and manipulating certain joints, but they may need to do some x-rays or even MRIs or ultrasounds to determine the cause, but you don't want to let that go unchecked. If your dog or cat, most likely your dog, but it can be a cat too, is pacing or is restless, get him to veterinary care. But of course, there are a few things you can do first. Take a look in his mouth, for instance. See if something's caught, if he's having trouble with it. Go feel his belly. If he has a great big belly, a beer belly that wasn't there an hour before, this could be the onset of bloat. And bloat, as we talked in the last episode, is a life-threatening situation. And a pet can die in 20 minutes or less. So don't delay with that. Anytime a pet's feeling anxious, or just in my basic terms, isn't, if you know, here, this is the way I want to say it. If you know what's normal for your pet, you can more quickly determine when something isn't quite right. So that's why it's just so important we put on, a new pair of eyeballs once a week and really tune into our pets. Pay attention, see what they're trying to tell us or what they're not letting us know. Because the more that we know that what is normal for them, and they're unique individuals, what's normal for one may not be normal for the other, the more quickly we can determine when something isn't quite right and get them the help they need. If your pet has lost his appetite, gosh, I always hate putting this one in here, but it's like that one sign that when we all are afraid to make those final decisions about sending our pet on to the last chapter, usually that's the one that most of us use as the clue that when they're no longer eating, the time very often has come. Now, with that said, there can just be something else going on that's very fixable, especially in a younger pet, and we just need to find out what it is. Sometimes it can be problems in the mouth. Maybe you haven't been doing good dental care, or in spite of your best efforts, your dog or cat has an abscess or a loose tooth, or something's caught, a toothpick or a piece of bone, or something's caught in the mouth, making it difficult. Some pets actually get mouth sores from drinking out of plastic bowls. There's something about the polycarbonate or whatever's in the plastic bowls that leaches chemicals, and sometimes will give mouth sores. And maybe it's something as simple as that you can correct that is making the pet not want to eat. Sometimes as our animal friends get older, their sense of smell wanes. We know how important their sense of smell is to them. I mean, it's all about getting out in the morning, checking their pee mail, and just smelling everything 24/7 pretty much, and they have such an intense sense of smell. But if that starts to fade due to an injury, an illness, or just getting older, the food may not be as appetizing. So you're going to need to make it a little smellier for them to enjoy it. Sometimes if it's a canned or a wet food, adding some warm water or just warming it a slight bit. Don't ever take canned food in a microwave or an oven for too long because it really gets nasty smelling, I'll tell you that for sure. But just warming it up sometimes will increase the intensity of the smell. The thing I think is the greatest to do is to add omega-3s, those fish oils, whether it's a dog or a cat, because they do so much good for our pets. If you go back in the archives, remember all of these Facebook Live videos you can find on my YouTube page, The Sunny Dog. I did one, I think it was back in February, on omega-3s and really talked about the benefits, but they can do so much for the coat and the joints. They help bring back tear function sometimes if that's gone. They sometimes can help with seizures and heart issues and just so much more. So if your pet's not eating his food and you add some of those smelly fish oils, the salmon, the krill, and the one I like best is the hoki from New Zealand because it just comes from those pristine waters without anything in it. So go back and check that other video. But that might be, just the thing you need to increase your pet's appetite. Sometimes if they won't go to the food, maybe you can just stimulate their appetite by doing some other things. With kitty cats, if you get clam or salmon or tuna juice and just freeze it into little ice cubes, or chop up liver into little ice cubes if it's the warm part of the year, maybe just by having them lick or suck on that, it might increase their appetite. So, do what you can to intensify the smell. But if this is an ongoing thing, or if you're at an end-of-life stage, that's when I tell you to feed them whatever they will eat. If they will go to the deli, get that roast beef deli meat, or if it happens to be the canned salmon, or whatever, the peanut butter, whatever nutrition you can get in them. But obviously, when they're not eating, something isn't quite right, and we should have them checked out just to be sure what it is and how best to fix it. Now, if a pet's losing weight, that's another sign that we need to get veterinary care if it's not something we're trying to do. Just like us, sometimes we have to get a few pounds off our pets. And just a few pounds can mean a whole lot more to them than it does even to us, and really can benefit their health and their longevity. But weight loss is basically called anorexia in dogs and cats, even if it isn't to that extreme. We would think of it as humans. And if pets are losing weight, and nothing has really changed, as far as something is happening where they're not taking in as many calories as they're using up. Sometimes muscle actually wastes as animals get older because they seem to be eating. They might even be voraciously eating more than they normally do, but somehow their body isn't assimilating those calories. So this definitely requires veterinary care and should be attended to. Breathing difficulties. If your pet is having any difficulty breathing at any stage in his life, just like you, get him to veterinary care. We've talked about these things in the past, and very often that can be treatable at home, but if there's any sign of breathing difficulty, get them to the vet. Sometimes fluids accumulate around the heart or the lungs. That could be the cause of breathing difficulty. Maybe there's an obstruction. A bone or a ball or something caught. Maybe there's an illness or an asthma. Maybe it can be related to allergies. Like I said, all of these symptoms can have multiple reasons for happening. But if your pet is having breathing difficulties, you need to get him in the vehicle and to professional veterinary care for a checkup ASAP. Two more I want to talk about today. One is red eye, and I don't mean that as a specific name of something wrong, but anytime there's anything red in the eye, some dogs get entropion, in which the eyelid actually curls in. Some get cherry eye, where there's actually a little bit of pink flesh that forms or bulges out around the eye. These all need to be surgically dealt with because it'll irritate the cornea and can affect vision over time. Sometimes it could just be a conjunctivitis, an inflammation there due to like a virus. And sometimes it's something as simple as an eyelash or a speck of dirt that's gotten in there. And then that's when we go to our handy dandy first aid kit and get out our eye wash. Basically, it's just purified water or saline and try to flush it out. But if there seems to be redness, your pet could have scratched his eye on a piece of shrubbery. on his own claw when he was scratching, or if he has any playmates, their smaller claws, on toys, if your cat chews on stuffed animals, and maybe one's a kitty cat and it has those nylon whiskers. Any of those things can cause injury to the eye. And just like with us, we don't want to let an eye injury go untreated. Antibiotics are probably in order, as well as care, because we don't want the pet to suffer pain and difficulty in seeing, but we also don't want him to lose vision. So make sure that if you notice a bite wound, pale gums, lethargy or weakness, pacing and restlessness, the pet isn't eating or losing weight without us trying to make him lose weight, is having breathing difficulties, or has any injury to the eye, you get veterinary care. There are two more things here I want to talk about, and one is jaundice. I alluded to that earlier when we were talking about the gum color. And sometimes when the gums are yellow, kind of in the range of some of the yellows here on my poster, that generally means either the pet has problems with his liver, Haiku's saying hello again, or he could have zinc toxicity, Z-I-N-C. And where would a pet get into zinc? Pennies, minted after 1983, are basically zinc discs, and as they sit in the tummy and the stomach acids melt that down and dissipate the zinc, your pet can get breathing difficulties, vomiting, and even death can occur. 2 pennies can be problematic for a small dog. Why would a dog ingest pennies? Who knows, but they do. SPF, if you have any of the zinc oxide that goes on your nose or any part of your body and the pets lick it off. Diaper rash ointment often contains zinc. So just keep things with zinc out of paws and claws reach, even certain nuts and bolts. And lastly, collapse or fainting. And I hope that is a no-brainer, that anytime your pet faints or suffers what's called syncope, that you would get him to quick medical attention. But, hopefully you'd practice some of your first aid skills first and try to resuscitate, that you would, feel for breathing. If there's no breathing, give those 2 slow, full breaths. If you're not getting a pulse, begin on those cardio compressions. Something else you can do, kittens in particular sometimes fade due to low glucose, is rub a little pancake syrup or some honey or some Caro syrup on the gums or under the tongue and see if that helps resuscitate. But obviously, it's not normal for a dog or cat to collapse or pass out. So that is, the last thing I want to talk about today that requires veterinary attention. So just tune into your pets, love them, be in the moment with them, and know what's normal for them so you can more quickly determine when something isn't quite right. If you need to brush up on any of these skills, I have 2 classes coming up in May from the comfort of your own living room. We do live teleconferences where I can see you, you can see me demonstrate, you see my slides and videos. One is on May 6th. It's specifically senior pet care. The other is on May 20th, and it's a pet first aid and CPCR class, cardiopulmonary cerebral resuscitation. So you sign up on my website, PetSafetyCrusader.com, and I send you your materials ahead of time, and we meet up at the designated day and time, and we get you trained in whatever else you need to know. Just as a parting note, I'm going to have some exciting news about a disaster preparedness webinar where you guys can earn a certificate by learning. It's about 6 hours long. It's really intense. It's even if you don't have pets, it's awesome because it tells you all the things you need to do around the house to protect you as well as your 4-legged, feathered, fin, scaled, and furry friends. So stay tuned for that. But in the meantime, have an awesome possum week. Thank you, Barbara, Lucy, Paul, for joining in, and the rest of you. I hope you stay well and your pets stay healthy and happy for a lifetime of wonderful memories together. Bye-bye for now.